In this video, I'm going to be demonstrating how to insert a urinary catheter, a straight catheter, not an indwelling one. So we have our supplies here. I'm going to go ahead and I'm going to open up our box. The first thing we have is our small towel that is going to be used as a barrier. We want to make sure that we are placing the shiny side down so that it is absorbing the fluid. We're going to make sure that we get that as close as we can under the patient. Now that I have that set, the next thing that I'm going to do is take out my sterile gloves. Going to cuff my other glove. Now my hands are sterile. I'm going to move my supplies over to my working area. This is a drape. It is not necessary that you use the drape, but you can. I have my swab sticks. I have my specimen cup. I have my lubricating jelly, and I have my catheter in here. First thing I'm going to do is cleanse the area. Going to remove all 3 swab sticks, place them in here. Going to go ahead and get everything prepared because once I touch this area, I can no longer remove this hand. It's no longer considered sterile. I'm going to open up my lubricating jelly. I'm going to go ahead and squirt that in the basin here. Throw that away. I've got my cup prepared. I'm going to take the lid of the cup and I'm going to place it over here on my table, making sure that it's facing upright. Now that I have everything ready in my basin, I can go ahead and start cleansing the area. So I'm going to open up this area here and I want to start furthest away. So I'm going to clean top to bottom, drop it, take the next swab stick, clean top to bottom, drop it, take my last one and clean top to bottom right down the center. And now I'm ready to insert my catheter. So it already has the lubricating jelly on it. I'm going to push it up forward a little bit closer to my patient. And I'm going to go ahead and I'm going to insert here. I'm going to go until I see urine. Once I see urine, I'm going to go a little bit further. I'm going to pinch that off, take my cup, fill up my specimen cup. My specimen cup is full. I'm going to pinch it off again while I move this over. At this point, I'm setting this here. I'm going to place the lid on my specimen. And now I'm going to allow it to continue draining. Once I see there's just a tiny bit of urine trickling out, I'm going to go ahead and I'm going to push a little bit on the bladder to make sure that we've gotten all that urine out. Once we've ensured that we've gotten all the urine, at this point now I can go ahead and remove the catheter. So as you're removing it, you're just kind of twisting it up in your glove. Now I've got that catheter out and we can go ahead and dispose of that.